Researchers say the clinical psychologists go through many of the consequences resulted from burnout, whether it's been personally or professionally by traumatic events such as patient suicides or even by emotional exhaustion and depersonalization, which are variables of burnout. Psychotherapy, which is the client and practice relationship of therapy, is mainly related to burnout in the sense that the psychologist believes that he or she could be working at the peak efficiency that they believe is best for their patient and for their case. Um, and this is also a sense of personal acceptance or personal accomplishment. And it's also a sense, it also causes a feeling of perfectionism and probably most likely low self esteem within the individual the psychologist point of view, and and that can also the feeling of of perfectionism and personal accomplishment and acceptance can also affect the correctional psychologist towards their actual job, in other words. And also there are signs of rigidity towards the clinical psychologist. Um, the clinical psychologist's own attitudes, since basically the base of their empathy and emotions aren't supposed to aren't known by other researchers to be mainly enforced in their actual therapeutic actions or practices. So this kind of creates a contradiction in their attitude and the way that they might perceive um, their emotions towards their actual patient or others. And also, finally, the need for emotional or therapeutic control over cases of patients is also a sense of the attitude that they must deal with. And since the attitude that they deal with has the control of emotions and of their of never mind. Basically, going back, um, the science of the rigidity towards the clinical psychologist and their own attitudes is what can affect the way that they might see their patient and their case, um, and um, and also the sense of not having control affects the psychologist and how they might perceive their job, since they can't handle so many things all at the same time, and they might have way too many patients to deal with, and might not have the time of day that other researchers brought about into this specific research. And the overall goal that the researchers wanted to find out was to investigate the validity of the therapist belief through the therapist belief scale, also known as a TBS, and also it was to examine the contributions of the different variables and the factors towards the clinical psychologist's overall burnout, since their therapeutic belief might be different from concluding from different aspects and different factors. Also, in the southern part of Australia, 507 questionnaires were given out to a total of to a, given out in total to clinical psychologists with a master's or PhD degree. And out of the 507, 190 of the questionnaires were actually returned with valid responses and valid answers. And also, yet again, the Malik burnout inventory scale was also used. Which is also known as MBI, and it's basically to measure the rate of burnout and the rate of burnout as well as the factors that were contributing to it. It also included the study of the therapist belief scale, also known as the TBS, which indicated that there was a higher score, that if there was a higher score, it would indicate that there was lower levels of the stated beliefs that the psychologist would work with, and or also healthier beliefs of their specific therapy motives. And as a conclusion from the entire research and the questionnaires, the four theme factors that were included were low tolerance of distress, inflexibility, belief of outcome and responsibilities, and the need for control in their therapy sessions. Towards and overall, these four themes basically all connect to the fact of burnout and how that the sense of emotional exhaustion in the way that empathy might affect their patient and staff member connections might change. Personal depletion can affect the way their views and their decision making, and also personal acceptance and personal accomplishment, also known as perfectionism, can also influence the psychologist in the way that they might not want to they want to try to exceed their expectations, but they might not be able to, and that can result in the fact that they can have stress induced burnout. Since stress and burnout aren't the same, which wasn't specifically defined in my research, in the research that the researchers provided. And also the research indicated that decreasing of unhelpful beliefs and an increase of the use of coping can decrease overall burnout. Since increasing the coping of, for example, the individual psychologists and staff members connecting together, they can support one another, and they can do other things that might help, as well as, for example, working together in training new psychologists, practitioners, for example. And if by doing so they can completely they can hopefully decrease the amount of burnout in correctional institutions from clinical psychologists.